My name is Paddy Sipho Nhlapo. As we talk about, re-engaging people that have disengaged from care, there's another component, which is the component of retention. Yes, we re-engage them. How do you then retain them? So first, you need to have understanding and appreciation of what their challenges are. No one speaks about sexual reproductive justice and sexual reproductive rights of people that are aging. One of the things that we've done a scoping exercise, I think my colleagues spoke to that, in 2023 to mid last year in 2024, where we discovered that amongst the barrage of issues that affect this one person who's taking medication, they're taking quite a lot of other medication. I'm sure they spoke about cardiovascular challenges, they spoke about TB, co-infections, and other comorbidities, including, by the way, cancers. There's a component that no one really, or that people speak about, but they don't tailor, which is the mental health challenge. So these two things, for me, I think they're going to be very, very important, because it is the mental instability that could lead one into disengaging from care. The challenges that people face. And mental health challenges come in different forms. Then you have diabetes, you have hypertension, you have osteoporotic challenges, and now you are also taking antidepressants. Then it becomes polypharmacy, and people do disengage because they're tired. They're tired of the many challenges that they are facing. On top of it all is the socio-economic challenges, but also the isolation, being bored. We don't think older persons need to be in entertainment space. I mean, look at TikTok. If they see you as an older person, older persons in clubs and recreational facilities, these kids have words that they use. The ancestor ifunani la. They should be watching after Abazulu. Is that what we came from for? They then must bear children, and then they become our responsibility. So all these things, our contribution will then to focus of those unimportant things, but that contribute either to disengagement, but also treatment interruption, because some people don't disengage permanently, they just interrupt. One of the stories, I'm not sure if they told you, one of our participants in the 50 plus scoping exercise was saying, you know what, I need to live my life. From Monday to Friday, I drink my ARVs, I take my tablets. But Friday night, Saturday night, and Sunday are my days. I go in your pool. Because I want a Monday. And they find that normal. Why? Because they are virally suppressed. They were told so at the clinic. When they did, it is a she, when she did a pap smear, she was found to be clean, because that's the words that they use. So they don't see the need. So no one continues the education that they get from a nurse, who's, by the way, overburdened. It's not like the good olden days where there was pre-test counseling and then there was in-depth counseling. Then you were linked with an organization that would provide psychosocial support, like the good old support groups. They are no longer there. They are not funded. So it's even worse now. The funding purse, we used to say the funding purse was narrowing and diminishing, but now it's gone. What is it that we can do as a country, the private sector and all that? So it's those things, our contribution. It's the understanding of what and where the problem is, and then come up with creative solutions to address that. Not everything needs money, but the contribution that we feel we can provide is experience, our technical know-how in shaping community structures as part of community system strengthening, because that's what you need. Because if we are saying let communities lead, we want communities to lead by empowering them, by capacitating communities. That is where our focus will be. It is possible to be on treatment and stay on treatment. Why I say so, I'm a living example of that. You continue to be a productive member of the society, but you avoid getting sick. Staying on treatment helps you stay with your grandkids. Staying on treatment helps you grow yourself in life. I started treatment just almost 20 years ago, and I've been living with HIV for 34 years.